I went through a lot of hopelessness because I just really didn't know whether or not I would be able to have my lifelong dream of starting a family.
This is an issue that is faced by so many Canadian couples. It is National Infertility Awareness Week, and to talk about it, we are joined by Dr. Niamh Tallon. Doctor, you are a fertility expert, should I say. Tell us about infertility. What's the definition to start things off?
The definition of infertility is being unsuccessful in having a child or a pregnancy within 1 year of trying.
Oh, so there is a specific time period?
Yes, it's 1 year for all comers. We do want to look at older patients sooner. We don't want them to be trying for a year over 40 because a lot changes in terms of treatment outcome in that time. So we ask patients to be seen within 3 to 6 months over the age of 40.
Now, what type, are there differences in the types of things that you're looking at, that you're finding, that you're seeing?
Yeah, we want to make a diagnosis primarily. So we're looking at both male and female issues. 30 to 40% of the time it will be a male that has an issue. And so we have to do a semen analysis in that situation. For a woman, we need to make sure she's ovulating, having a regular cycle, her fallopian tubes are open, and a normal uterus to house a pregnancy.
Go ahead.
But more and more we're seeing unexplained infertility, which is really an aspect of age in there as well, which is more common now.
So what do you do in that scenario?
So if all the testing comes back normal, we're really looking at fertility boosting, giving people a greater odds of success from where they would be on their own. And so we're looking at fertility treatments, anywhere from an insemination, placing sperm inside the uterus to get there quicker, all the way to something aggressive and very successful like in vitro fertilization.
How many couples does this affect?
15% overall.
Oh, so a fairly large number.
It is.
Now, as a result, have we seen advancements, things changing over the last 10, 20 years? Have success rates come up?
Success rates have been the best in the last really 3 to 4 years. There is new technology that we're using every day in our labs in terms of really looking at how to improve outcome with respect to age. We want to find the healthiest embryo that has the least least affected by genetic abnormality, which is really what we talk about when we talk about age. And so when we can find a normal embryo and give that couple that perfect chance of pregnancy, we're seeing pregnancy rates in the realm of 70 and 80%.
Is infertility hereditary?
It can be, but usually in a very small percentage of patients. So there's certain medical conditions like polycystic ovarian syndrome that can run in a female family, or endometriosis, or a man can actually inherit a gene mutation from his father and then have very low sperm counts.
But for the majority of the population, it's not something we know about until we're trying to have a baby. And
that is such an important point to emphasize, especially for young women looking at, how to plan their reproductive lives ahead. And we're seeing a huge trend in women wanting to know more about their own reproductive capabilities. And within there, we stress, look, we really don't know. You may have all the pieces to attain a pregnancy, but until you really try, we don't know whether or not you will have success.
So what's the process? Where do you start when a couple or an individual comes in to see you?
So a very long consultation where we take a history from both partners. That can take up to about 40 minutes. We really need to get a sense from the patients as to how aggressive they want to be and how quickly they want to move forward. We do an ultrasound at that visit, review all of their testing, and once we have a firm diagnosis, really target how best to get them there.
What about the cost? This can be quite expensive. Are the costs going up? Are they going down? Where do we start?
Pretty stable. In terms of the cost of an IVF cycle, it's about $7,000 for that. In BC, we don't have provincial support for patients going through treatment, which is unfortunate. They can claim medical tax expenses and try and get something back at the end of the tax year in that regard. In Ontario, there is support for patients going through treatment.
What's the average number of cycles that it would take to have success?
So that's, again, a very important part where we look at age. Younger women are more likely to be successful with one treatment cycle because they have better quality eggs. Older couples, we're really looking at saying, look, you need to think you may need a number of cycles because their odds are just less with each one.
Excellent. Excellent information. Thanks so much, Doctor.